stands for performativity, relativity, innovation, sustainability, and multiplicity, which we think are the key constituents of transformation in our times. So while we take this forward, we would want all of you to be with us. We will return with the PRISM series next year with probably with this theme of continuities, so we can recover models of continuities that are available here. Today we have Professor Srinath Reddy. You know, if you have followed the series, you will know that most of our speakers are very interdisciplinary in their approach. Right? Even as they specialize in one area, they are all the time trying to connect their fields with other fields of knowledge and creativity. So we have Srinath, who's talking about health coverage, which is a very important thing in India. It's a kind of extension of our last lecture by Harsh Mandar, who talked about the question of equity and homelessness and poverty. That was what he addressed. So this is Srinath's lecture is today extending that discourse to see how equity is possible, can be made possible in this field of health. And he is presently the president of Public Health Foundation in India, and he formerly headed the Department of Cardiology at AIIMS. And the Public Health Foundation of India is engaged in capacity building in public health in India through education, training, research, policy development, communication and advocacy. His work and leadership in these areas of health and human rights, he's working across the world actually, being part of a lot of initiatives across the world. This really inspired us. He's part of a lot of initiatives like this. I don't want to go through his biodata and give you those kind of information, but what is important for us is his work in the field of health is not really limited to the area of health, but his work is connected with various disciplines, from economics to international relations. There are a lot of connections that he has achieved through his work. That is very, very seminal for an organization like LILA. I welcome you, Srinath, for this, this is the last lecture in the series, and we're very privileged to have you. And Professor Mushkun Dubey is former Foreign Secretary to the Government of India, and is president of the Council for Social Development and chairman of the Asian Development Research Institute in Patna. He teaches international relations at JNU, and former ambassador. He's also professor emeritus at the Foreign Service Institute. He's currently researching on, even if you work at his work also, it's like a wide variety of things that he's engaged with. Researching on issues related to economy, security, trading systems, and international relations. I welcome Professor Dubey to this. We are indeed honored to have you here, sir, and I invite you to take this. Thank you very much.
Srinath Reddy and distinguished participants in this discussion. First of all, I would like to express my deep gratitude to the Foundation for those local initiatives for inviting me to chair in this lecture. When I heard that Professor Reddy wanted me to come, attend, and be present on this occasion, I lost no time in accepting it, because you can ignore the doctor's prescription only at your own peril. I have known him as one of the most brilliant cardiologists of the country in his somewhat younger days. He continues to be a specialist in that area, but then he diversified and went to this institution where he had got his great sense of social justice and equality to bear on the work that he has done. And this is very well reflected in his landmark report on universalizing healthcare, which he submitted on behalf of the high-level expert group set up by the Planning Commission on the eve of the finalization of the plan. And I, for one, had hoped that provided the nation a very good opening to launch a scheme for universalizing healthcare.